Dr. Jonas Apostol.
I'm on Viviys. So I'll be discussing to you the case of Ivy. She's the sister of Cortez. So patient went to my clinic with the chief complaint of having this unbalanced smile. So it's not harmonious with her smile, or with her face rather. And also, syempre maganda din yung smile ni V. Gusto niya din, syempre maganda din yung smile niya. Okay, so let's talk about the patient's case. As you can see here, she's currently wearing these two crowns on the front teeth. The upper right, central, and lateral incisors. And also, there is an obvious restoration on the upper central left side. It's pretty obvious also that it is protruded and hindi siya talaga in harmony with the lips pa lang. Medyo nakalabas siya. So if you try to check on the premolars as well, it's collapsed, especially on the upper right, and medyo prominent yung canine. And the shade, notice the color of the teeth, okay? Different shades. Hindi siya even or too obvious that there are some fake crowns in there that we have to replace.
Before, no elementary hanggang second year, yung mga picture ko, kita ang ngipin. Pero after ko ma-root canal, hindi ko na ginawa. Kasi nga napansin ko sa picture, nakitang-kita yung magkaibang color.
So, yun. Gusto ko natural looking talaga. Okay?
So if you look at V and Ivy, may similarity sila, magkamukha sila almost. But it doesn't follow that we will copy the design ni V to IV, no? Kasi iba naman sila ng work, iba naman sila ng agenda, how they use their smile. So, V requested for a wider smile, while IV naman, natural looking lang, okay? So, yun yung ibibigay natin ngayon for IV. So, we need to make sure that it should be appropriate and in harmony to her face. So the upper lateral incisors where root canal treated teeth means it's non-vital, so patay na siya. Discoloration is common, okay? So may malaki siyang cavity before kasi it was done, the extent of the cavity went far. That's why it ruined the sound structure of the teeth. So my treatment plan for Ivy's case would be 3-unit crown and 5-unit veneers. For the root canal treated teeth, I will be using or doing crowns, okay? And for the sound structure, no problem, hindi na root canal vital, I'm gonna do veneers. Okay, so the most frequent questions during our Ask Dr. J segment was, is it necessary to do crowning after root canal treatment? No. But I'm gonna tell you, it really depends on the case. For this case, it's root canal treated teeth, but it's been there, like damaged for a very long time, and also it's discolored na. So we have to do crown. But for some cases, let's say for example, hindi naman masyadong damaged yung ngipin, okay? But it reaches the pulp area, it requires root canal treatment. That can be treated with veneers lang or simple filling. Okay, so let's talk about smile design. Okay, smile design is very, very important to be able to come up with the best result for the patient because every case is different, no? So we have to make sure na yung design natin is para talaga sa kanya na babagay. Okay, so with her facial structure, we have to consider na medyo a little bit thick yung lips. So we have to create a more protruded or medyo manipis na ceramics para hindi naman masyadong mukhang naka-protrude yung upper lip, okay? And also we have to distribute the premolar area yung tinatawag natin buccal corridor, the collapsed area should be raised a little bit or add more volume on that side. So smile design kasi, it will take like few minutes, 30 minutes to an hour. So I will let the patient wear it for at least a week while waiting for the final outcome. Pero it doesn't mean that we will copy lahat-lahat na yun kasi we can still enhance everything, the appearance of the teeth, the morphology and anatomy. We can still do something that could enhance or improve the ceramics. Kaya may tinatawag na try-in. Doon natin nakikita lahat. On the teeth preparation, we remove all the unsound structure. We have to make sure that all cavities must be removed, even the incipient cavities or caries should be removed kasi those are unhealthy structure. It can create problems in the future if left untreated. So for the discolored teeth, sometimes I need to put some opaquer na composite base, but since I'm gonna use a zirconia core for this to be able to mask it and not to expose the discoloration, so okay na kahit hindi na natin siya i-coat na opaquer. So after teeth preparation, then we will get the final impression and then place in the temporaries. Yung temporaries naman on the provisional will be based on the design na ginawa kanina. So that's one of the purpose of the design so that the patient could check while waiting. Check the design if it's like gusto niya na while waiting for the permanent one.
1 week later.
So we did the fabrication of the zirconia fused to a porcelain in our own in-house laboratory. In this case, I used our CAD/CAM machine to get the zirconia or be able to fabricate the zirconia. Tapos we layered it with porcelain. Okay, so all the details should be done in the laboratory, modifications and all. Siyempre, I have a close communication with my ceramist. I have a team who's responsible for my ceramics in the clinics. So here comes try-in. So after a week, babalik yung patient, we remove the provisionals, and then we try our permanent ceramics kung bagay na. And also the fit should be perfect. We have to make sure that there's no impingement of the gums, and also the margin should be on point. Excess cement should all be removed, cleaned lahat-lahat before natin to ipa-permanent cement. Okay? So that is a very, very important process in doing veneers or inserting a ceramics. It looks really amazing. Mas maliit na siya. It suits well with her face. It's not as like before that it's too prominent and too bulky na it looks protruded. Right now, mas maganda na. So we agreed to cement it right away, same day. So let's talk about the result of the smile makeover. She requested for a natural looking ceramics. She wanted to look like it's her own natural teeth lang, na hindi bulky, not too white. Of course, because she has a morena complexion, so we wanted to create something more balanced naman, and also the gums is not that pink, so we have to make sure that it should blend well with the color of the gums and the teeth. Also, there's a little bit of translucency, but not too much because it's her request, because the original teeth is not that translucent as well. And also the collapsed premolars looked way better because we added volume. Also, it looks really natural na ngayon. So during that try-in, Ivy actually was amazed at the result kasi she's expecting that the crown is a bit bulky than the veneers. So hindi niya inaakala na it would be the same, na identical to each other, that it looks really natural. So that's one of the tricks now in ceramics. You won't be able to tell if it's veneers or crowns. Of course, we checked on the bite, so we made sure that we run it with our T-scan machine. It's a digital lucid analysis, wherein we were able to check if there are any parafunctional contacts that would be detrimental for the patient's bite in the future. I'm honored that V and Ivy entrusted their smile makeover to me because I know that in their business they want a more confident smile kasi it's their business. I mean, it requires talking and speaking to a lot of people. So my job is to help them achieve that beautiful smile, to help them to be more confident about themselves. So thank you very much for trusting me. So my role as a cosmetic dentist is to provide that beautiful and confident smile that would lead them to more success in life. So thank you very much for trusting me.